Dr. Michael Knapton, you're with the British Heart Foundation. You're also a GP. When people come to you as patients and ask for advice on how to stop smoking, or when you advise them to stop smoking, what can you say to them and how can you help them?
Yeah, so there's quite a lot we can do in terms of helping people stop smoking. The first thing, to be honest, is understanding what their motivation is to stop. Because if they're not motivated to make that step, you're going to struggle. And it's hard enough because we know that nicotine's very addictive. But in the NHS, in the UK, we've got quite extensive smoking cessation services. So I, as a GP, can prescribe nicotine replacement therapy for smokers and drugs as well. And we also have local smoking cessation services where they would get advice. And we know from our National Institute for Clinical Excellence that that sort of program of smoking cessation plus NRT is the most effective way of helping someone quit.
So NRT are nicotine replacement treatments, like a patch or gum. What about the e-cigarette? Where does it fit into this picture?
Yeah, so we've got 3 million people using e-cigarettes at the moment. We don't prescribe e-cigarettes. It needs to be regulated by something called the Medicines Healthcare Regulatory Agency before we can prescribe these things on the NHS. So at the moment, the position is that I would condone someone. If someone wanted to use an e-cigarette, either to cut down on their cigarettes or to stop, I'm all for that. I mean, what I'm against is them using the tobacco, because that's what drives the cancer, the heart disease, and the respiratory disease. What we're hearing today is that e-cigarettes, in terms of safety, are much safer than smoked tobacco. And I think that's a really important message to get across to patients so they can feel confident that this is a much safer option than buying cigarettes and smoking them.
Would you like to be able to almost to prescribe them for those people who are hardened smokers?
Good question, actually. I think if they were appropriately regulated as a medicinal product, I would. Part of the reason for that is not everybody can afford to buy these things. That said, of course, they are paying for their cigarettes, so it would be switching one for the other. On prescription, that many people will be able to get that for free. I think before, though, I would want to prescribe it, I'd want more research to know what the true safety profile was, any side effects, any contraindications for certain groups of people. Could you use it for a pregnant mother, for instance, or not? And all of that is what we're waiting for, and all of that is what we're talking about today to try and understand how e-cigarettes work, how effective they are in helping people quit, and how safe they are.
We're hearing Public Health England, Department of Health, giving a very positive message about e-cigarette as a way to stop smoking. I mean, how do you think it would compare with these other treatments that you're talking about, nicotine patches, gum? Is it more effective, or do you have any idea of, from your patients, which they prefer?
Yeah, okay. So we don't know at the moment because the research is not done. We've got good research on the use of nicotine replacement and smoking cessation services, so we know that works. I don't yet have the similar evidence that e-cigarettes work. That said, it seems entirely plausible that they will. It's simply, in my mind, another way of delivering nicotine to people who are addicted, and it gets them off the smoked product to a non-smoked product, which therefore will avoid the toxic effects of smoked tobacco on your heart, stroke, your brain, lungs, respiratory disease, and obviously a lot of cancers as well. So it seems entirely plausible that this is a sensible way to go. As a doctor, though, I need to be really on firm ground when it comes to the evidence of effectiveness and safety, because that's what I'm there to do for my patients, provide them with good quality advice.